Hello, everyone, and welcome back from break. I am very honored to announce our next presenter, Dr. Jeniffer Weiss. Dr. Weiss is the Assistant Chief of Orthopedic Surgery at the Los Angeles Medical Center and specializes in pediatric orthopedic surgery and sports medicine. Growing up as a daughter of an orthopedic surgeon, Dr. Weiss saw firsthand how male dominated the world of medicine is. Throughout medical school, she encountered few female students aspiring to become surgeons. From the start, it has always been her goal to inspire women to enter the field of surgery and to not be intimidated by this largely male dominated profession. Please welcome Dr. Weiss as she discusses the topic I wish I knew. So, hello, Dr. Weiss. Can you see us and hear us? Let me gonna unmute you and
You. If you unmute me and let me start my video, I will. There we go. Awesome.
perfect.
And I'm going to share my screen.
Yes.
And
Okay.
you can see my messy screen. Here we go. And there we go. Almost there. Excellent. Can you guys see me and hear me?
Yes, we can see you and hear you both.
Excellent. Okay. So I've been kind of on and off today, listening to some of the speakers that you guys gathered for this group. And I was inspired myself, I have to tell you. So what a wonderful crowd of inspirational people with so many different paths. And from what I saw today, I think my path is quite different. And the way that I like to sort of share my story with people that are starting out their careers or thinking about how to start out their careers, I think it works best when I imagine myself at your age. Now, I'm 49. And things are very different now than they were when I was in your shoes, or in shoes similar to yours. But I really think it's helpful to do it in the form of kind of a letter or a talk to my 20-something-year-old self. So when I was 20, I was at Williams College, which is a small liberal arts school in Massachusetts, and I was an art history major. Very different from what I ended up doing. And I think that you find a theme from some of us, which is it's okay to swerve. And that word has taken on so much glory in the last year or two from Michelle Obama's gorgeous book, Becoming. And if you haven't read that, it's just phenomenal inspiration for women and success and listening to your own voice. So I was not steeped in medicine and pre-medical thoughts throughout college. I had a great sense that I was going to become a physician, that I was going to become a surgeon, an orthopedic surgeon even. But what I knew was that I had so many other interests, and that I didn't, even at that young age, I felt like it would do me a disservice to hone in too much, too early, too quickly. And I happened to connect with a program which still exists in a different iteration at Mount Sinai School of Medicine, in which there was a recognition that physicians from liberal arts backgrounds had something unique to offer patients. And so they went and created a program with some smaller liberal arts schools on the East Coast mostly, not all small, but they recruited about a fifth of their class through this program. And they really encouraged us in this program to major in things that were not science. So I had a very special opportunity. And what I found when I got to medical school and ever since then is this thinking in a broader term has served me, and more importantly, served my patients in my field tremendously. They expected people like me and people from our program to be primary care physicians. And what they found was that most of us actually ended up being surgeons. And I don't know what that says, but I do know that it was unexpected, but unexpected and a pattern that remained over the years. So it may have something to do with the way people get excited about other things in the world and how they are struck by surgery, perhaps. I don't know. Um, so I will share with you my early years. The big guy in the trench coat, my dad, he was an orthopedic surgeon. His name was Andrew Weiss, and he grew up in with zero means. I shouldn't say zero. He was fortunate there was food on the table and he was able to go to school. He grew up in Brooklyn, and there was a family friend who introduced him to a scholarship program that he applied to, and he was able to get himself into Williams College. There's a theme. I'm a lot like my dad. I'm not quite as tall as him. He was 6'6". And then he went on to become a physician and an orthopedic surgeon. My mother was an occupational therapist for much of her life. And I know we were talking to somebody earlier, hearing from somebody who was going into occupational therapy. She is a brilliant woman. She loved being an occupational therapist. And she also shares with me that she's not sure she wouldn't have tried to become a physician if it were more common in her sort of time of life. And she was very insistent that I really apply myself from a very early time and not follow gendered sort of expectations, because she felt like she may have done that more than she wished she had, if you will. But my family put education above all else for all of us. My brother and my sister, they're my people in this world, and neither of them went into medicine. However, my sister does teach mindfulness and does a lot of work in the medical field, and my brother went into finance. But again, the education just being so important to us. And these are the next people. They're my kids. And my handle on social media is my mom, the surgeon. And I do something that a lot of people recommend not doing on social media and in general, which is I talk about both my family life and my personal life as well as my professional life. And I do that with a huge intention, because when I was growing up and when I was a resident, which is what you do after medical school, there was a lot of talk about these kind of boundaries of life happens over here and work happens over here. And sometimes there's some intermingling, but not so much. And there was this kind of almost schizophrenic way of going about things that I thought was very unhealthy, quite frankly. And I believe that in a field that is so male dominated, that we are not going to be successful in moving the needle and attracting different sorts of people to be orthopedic surgeons if people cannot see that you can do different things and approach it in different ways. So I'm very vocal about being a mom and a surgeon in all walks of life. And another sort of transition that I've made is the term work-life balance, I think, is nice, but the term in the last decade that's really become impactful for me is work-life integration. So understanding that I am me, whether I'm at work or whether I'm at home, whether I'm doing yoga, whether I'm at the beach, whether I'm playing tennis, whether I'm in the operating room, I'm still the same person, and I don't have to shut off half of my brain to do that. And to give a great example, you may see some of my children running around behind me while I speak today, because they're all around the house today. We really continue to put education above all else in my family. This is my oldest graduating from her sixth grade class last year, or 2 years ago now. She would be very irritated if she thought that I shorted her a year. But putting education and facilitating the learning process for the generation that comes after me is really what I promised my parents, and I continue to do. So, an impactful moment for me, you would probably think that I would have something scientific up here, or no. One of the biggest things that really hit me hard when I was growing up was I fancied myself to be a good tennis player, and played growing up in grade school and in middle school. And this is a very privileged problem to have had. I get it. But I was cut from my high school tennis team. And the way that made me feel, we talk a lot about how we react to failures in our life. And I think that this is one of the things that solidified how I wanted to approach my career, because I loved athletics and I wasn't as top an athlete as I needed to be to succeed at that level. Yet it created this desire for me to channel what I wanted to do. This is me very pregnant with my second child playing tennis. And so I just bring this up to say, whatever it is that we do to enrich our lives outside of whatever medical field you may choose to go into, embrace it, love it, and understand that it's going to help you connect with patients in many ways by being multifaceted. So here's one of the ways that this all has worked out for me. I've had this love of sports. I'm not a professional athlete, but for many years, I did take care of the LA Galaxy. And that was such a privilege for me to be around these athletes and taking care of them and operating on them and sort of living life alongside them for a long time. So taking these passions, I mentioned I had my art history, I had my tennis, they can really play into the choices that we make professionally as well. So it's not things that you have to put to the side or the back, pull them in, understand what you love about them, and help and have them help you with your decisions. So about 10 years ago, I was very first asked by our Orthopedic Society to share this perspective of being a surgeon mom. Can I have it all? And that was probably the first time that I recognized that I really had something to offer to the women coming up behind me, to show them that this is all okay to put together. So this was us. This is my now almost 14-year-old, my 10-year-old, and we looked like we were having a lovely, calm vacation. But this is really what was going on. We were so chaotic in that time of life. I was pregnant with baby number 3 that we had to have 2 au pairs. And I say that because literally I was in a world where I was waking up and out of the house by 6 a.m. and not home until these little ones were going back to sleep at night. And my husband was working full time. And with the au pair rules, they can only work so many hours per day. So we had to have 2 of them to get by. I didn't have family that could help me nearby at the time. So the sort of smooth sailing ship is really never what it seems. One nice thing about what I do is I could have the finances to support a world in which I could afford childcare so that I could keep working and doing what I needed to do. Again, recognizing the privilege, and I'm very, very fortunate about that. One of the nice things about choosing a career in healthcare is that it is something that will be predictable in being able to take care of yourself and your family financially. So that's really a lovely thing. I think it's important that as we're going through life and understanding the bumps and the difficulties and the difficult climbs, remembering our purpose and our why. Why do I do this? Why did I do this in the first place? Why do I continue doing it? And why do I make the decision every dang day to go back and work my tail off to be a surgeon? And these are two examples of why. The kids, the patients, the relationships that I form with them and their parents or families. And I take care of adults too. But these relationships that I form, for me, that's the why. I love being a surgeon. I love the technical nature of what I do, and I'll get into that a tiny bit here. But my be all end all is connecting with my patients and being able to do something to make them well or better or happier in some way, shape, or form. And being a surgeon is a very quick fix, quite honestly. Being a surgeon, somebody has something that is hurt or broken and needs to be fixed, and we operate on it, and our role is very tangible. Whereas being a working in medicine or in healthcare that is not surgical can be much less tangibly we can be much less able to tangibly see the difference in what we're doing. That doesn't make it any worse. There's phenomenal aspects to it, but for me, I recognized in myself that I really liked that ability to make a tangible change. Here's something else that has inspired me, and actually 9% is wrong, it's 6%. Women physicians by specialty. Orthopedics is really, really, really low. Neurosurgery is actually below us. They're not on this list. And 6% is the percent of practicing board certified orthopedic surgeons in the United States of America. So women would rather be urologists than orthopedists. That's a problem, and that's a problem that I am very vocal in trying to move the needle on. So vocal that I'm spending time on a Saturday in the afternoon talking to this group of awesome young women to say, and young people in general to say, please join us. Don't be afraid by male-dominated fields if you're a woman, because there are ways to really make an impact. Why is it important? It's important because patients like to have physicians and clinicians that understand them. And a lot of patients want to have a physician or a clinician that looks like them or has the same background as them. And so 50% of women in this country don't have the opportunity to have an orthopedic surgeon that is their same gender. Even worse is underrepresented minorities. Orthopedic surgery is only about 4% of made up of underrepresented minorities. And so there is not an opportunity for our patients to get healthcare from people that are like them. And that can lead to bad things like disparities in healthcare. So it is really important that this shift. These are, you can see behind me my framed version of the She Can Do It. But we harken back to Rosie the Riveter and women kind of finding their strength and their voice in this country. And in many ways, the military has taught us a lot about how to incorporate, recruit women, and how to best sort of even the playing field with women in the military. So we're learning a lot as we go. They're ahead of us in that. So this is Valerie Lewis. She was one of the first women that I ever had the pleasure of having as a friend and mentor in orthopedic surgery. And she was quoted by the Chicago Tribune. This is over a decade ago. But so important. We have to appeal to all of the medical school class. And if we're not appealing to 50% of the class that is women, then we're losing some of the best and the brightest. And that remains true. And again, I told you we we're taking some lessons from the military. Then Defense Secretary Ash Carter had a very similar quote, which is, you have to recruit from the American population. Half the American population is female. So I'd be crazy not to be, so to speak, fishing in that pond for qualified service members. So I am very attracted to this kind of superhero theme. This was even pre-COVID that I started to think about this. That what we are doing in healthcare every day is really putting on some sort of a superhero cape so that we can go and give to the people that really need us. And I was listening to Dr. Fitzpatrick and really the ways that she has reached out and given such a gift to this world by being who she is. These are the kinds of people that I hold so in such high esteem with their superhero-ness. And this meme on the bottom of "it was never a dress" is something that I have hanging in my office at work. Um, there are very few of us that are women in orthopedics, but we have a very tight hive. And this, what's really interesting, I know I seem so old to you guys because I'm 49, but I'm young in my field. And I am kind of one of the older women who has brought this hive together. It is such a pleasure for me because when I was coming up, women that I interacted with were so few and far between. And now I'm so fortunate to have all of these women that I call my friends and to interact with them. And it's important. What we're going through on a daily basis, we used to feel like these unicorns. And my friend Rachel Goldstein, who's an orthopedic surgeon at Children's Hospital Los Angeles, in the bottom picture, she's wearing the tank top. And if you look closely, it's got a unicorn on it. We all felt like we were these unicorns going through our lives. And a huge piece of what was able to bring us together, quite frankly, is something that you guys are all very fluent in, which is social media. And as social media has become a way for us to come together, we're all feeling less like unicorns and more like a group of people that can interact very well. So Los Angeles is a huge city with a lot of orthopedic surgeons, hundreds and hundreds. This is a brunch that we had 2 years ago. And this is the majority of the women that are orthopedic surgeons in Los Angeles. So we're just so few and far between. Sitting in the corner in the sunglasses is Dr. Cargile, and she's very special to me. About 2.5 years ago, I got a kind of pop-up message on Instagram, which is, it was one of the first times that I learned that there was this kind of like other bucket on Instagram that if someone reaches out to you that you don't otherwise know, it pops up there. So she reached out to me and she said, "I've been following you and I'm here in Los Angeles and I want to be an orthopedic surgeon and I don't have a mentor and I don't know any women in orthopedics. And I just want to let you know," like she said some kind words. And I wrote her back and I said, come over to my office. Let's talk. How can I help?" She was at a program that she was at a medical school that didn't have an orthopedics program. And she is such an accomplished woman. And she came in and we met and I got her involved in some research. And I'm very proud to say that she matched at her #1 program for orthopedics. And she is now an intern at University of Southern California Orthopedics program. And the best part of the story was one of the other programs where one of my dear friends is a residency director. I got an email from him yelling at me the day after the match to say we were really sad that we didn't get Dr. Cargile. So this is a woman who I watched just kill it with her residency applications. And she is going to be the sort of woman for this next generation to look up to. So it's again another reason that I'm really embracing social media for the women in our community to come together about male-dominated fields. It's important for us to celebrate orthopedics as women's work. because what happened when I was coming up through medical school and residency is there was a joke, and I'm going to tell it, and it's going to make my skin crawl, but I'll tell it anyway. Early on, one of my attendings, when I was a resident, said to me, "Hey, Dr. Weiss, there's two kinds of women that are in orthopedics. Do you know what kind of women they are?" And I was like, "No, I'm not familiar. What kind of women are we?" And I was in the South, and it was interesting. And he said to me, "There's the kind that shouldn't be women, and there's the kind that shouldn't be orthopedists." And I was like, "Thank you very much for those words," and went about my day. But those are, we have the term microaggression. That was a macroaggression. That was just aggressive, inappropriate, awful. But those are the things that I heard very frequently. And I didn't have a lot of women around me. There was one woman who graduated from my program right after I started, and another woman who came up 2 years behind me, who is wonderful. And so connecting with them was always amazing. But that we were just so few and far between. And it just warms my heart that I'm showing you pictures now in the bottom corner. My physician assistant is a woman. This is a group of women that I was operating with one day, an all-female group. Top right is one of the women who was one of my residents last year. And it makes me so happy to connect. You'll also see a lot of tools in the picture on the bottom. And those are some of the tools that we use to be orthopedic surgeons. It's very hands-on work. It's very, some people call it sterile carpentry. It's super fun. And if you can imagine doing like a carpentry job or work where somebody brings you everything that you need and then takes it away and cleans up after you, that's kind of what it feels like sometimes. Like every day that I'm in the operating room, I'm like, I can't believe I get to do this with my hands. And it's so gratifying. But in a vacuum, it wouldn't be. What's most important is the people that I'm connecting with before and after I operate on them, and connecting with them and going through their journey with them. So the 94% of men that are in my field, I'm so blessed and grateful for this kind of allyship. I mentioned that my dad was an orthopedist, so I entered orthopedics in a way of understanding that the role that men had to either welcome or not welcome the women. My father was a residency or was a chairman actually of the one of the programs in New Jersey, and he was very proud to have a lot of women in his program. So I asked these guys to show their biceps for these pictures. They're not normally going around doing that. And this is an image of an award for good behavior. And the reason that I show this is being a woman in a male dominated field, it's really hard sometimes to keep that smile on our face. And this is one of our physician assistants, and she made up this award because sometimes the surgeons were pretty grouchy and not very helpful to the physician assistants. And so she made this award up and started giving it out to people when we were doing things like being kind and being nice and things you would hope we would do anyway. So this is an image of me in the boardroom of our orthopedic society. So almost all of the orthopedic surgeons in this country are a member of the AAOS, which is our orthopedic society. And this is me in the boardroom. And you look around that table. The other woman, by the way, who's at the end, who you can see, there's a woman sort of two down from me with long dark hair who is one of the staff members. But the other woman who was in the boardroom actually was the first woman president of the Orthopedic Academy, a dear friend and mentor. And so there was one other woman in the orthopedic boardroom with me. So I'll kind of leave you with this, that anything can knock us off balance. And it's really just important to how are we going to regain our balance, and how are we going to keep a smile on our face along the way. Work-life integration, as I mentioned, is so important. This is my solace. My yoga has played a huge part for me, and just working out in general. And if I am having a crummy day, the most important way that I turn it around is making sure that I get some sort of movement in, and it may be in my office for 5 minutes, and it more preferably is a longer period of time. These are some of the men that have been in my life as allies. And I want to share with you that this is a group, this is the only time I've been surrounded by this many women in orthopedics. We had a program where we had a joint pediatric orthopedic program in Europe. And when we got Europe and the US together, we did have a nice group of women. Takes a lot of faces and shoes to get through the day, and understanding and shape shifting through the day can be really important. These are my friends from medical school, and this is a then and now because we had this Zoom call just a couple of months ago. They're still just dear, dear, dear to me. We're across the country or scattered around the country, but they're my people. And the people that you meet during your training and your education, hold them close. They're there to get you through the times. And I want to invite any of you who are interested that are women to think about joining our Facebook group, which is Women in Medicine Staying Fit and Staying Sane. It is about 550 members actually now, and it's a great forum for asking different women about different things. So with that, I guess we go to a Q&A. Is that right?
Yes. If you want, you could stop sharing your screen. That way our attendees are able to see both of us.
You got it. Let me do that.
Perfect. Thank you so much. And thank you so much for your inspiring presentation. I really love how you are able to use social media to both connect with other women who are surgeons and also inspire the next generation. And I totally love how you're able to connect both your personal life and your professional life. So I really like that. Now it's time to answer some questions from the Q&A. So I'll read the first couple of ones, and anyone else who has questions, please make sure to put them on the chat and I will read them out loud. So the first question is, what helps you get through tough days when a patient has bad outcomes after surgery?
Yeah. So the first thing that I would say when there is a bad outcome is, number one, accepting that that happens, that no surgeon, no clinician is perfect, and no procedure is without risks. That doesn't make the emotional aspect of this any easier. So what gets me through it is, number one, connecting with the patient and the family. That is the most important. Early in my career, I learned that anybody who has a complication gets just complete access to me, and nobody's ever abused it. And the reason is I don't want them to feel isolated or thrown to the side. The second thing that I do is, I told you, I turn to my exercise. And so even if when I find the news out, if I have a moment to be able to do a quick little something to get back into my own head and my own body, and that's important. And then lastly is connecting with my peers. So people that have been through it, because nobody else really understands. There's something called second victim, which is, the first victim is the patient who's experiencing the bad outcome. And then the second is the clinician that's involved. And it can happen for physicians, surgeons, nurses, therapists. And it's really important work that we don't let people carry it and let it weigh too heavily. So having peer support is really important.
All right. Thank you so much for your response. The next question is, what is a good way to deal with microaggressions? What do you say or do?
Yeah. One, I've been reading this book that I'm sure many of you are familiar with, called How to Be an Anti-Racist. And it's a wonderful book. And I only just read this portion the other day, in which the author shares that there's no such thing as a microaggression. He says, stop calling it that. They're all just aggressions. It's aggressive. So one thing that I'm learning to do is actually recognize that. The second is, it really depends on where I am in my life and my career. When I was proving myself, I think I tried to use a sense of humor and deflection. In 2020, I don't believe that it's our cross to bear, if you will. If somebody is being aggressive toward us, wherever we are in our career, there's a way to report that and to stand up for ourselves. So I really, if you had asked me this question 10 years ago, I would say, okay, use a sense of humor, get yourself through it. But now, no, don't take it. If somebody's doing something that's inappropriate, aggressive, whether it's micro or not, we report it and we get that person educated.
Right. I totally agree. Okay, our next question. How have you seen the use of social media grow in healthcare?
Yeah. So what's interesting is there's so many aspects to the social media and healthcare question. There's the connections of physicians connecting with physicians. There's physicians connecting with patients. There's education. So there's lots of ways to share cases and get input. And there's ways to uh, advertise or slash make known positions that are available, sort of for job finding and things like that. They're all fair game. What I think, what is important for us, I believe, is to use it for a tool for clinicians to stick together, because I think we are in real danger of healthcare being taken over by administrative, non-clinical people. And some of them are very wonderful, but we as clinicians really need to stay involved with one another so that we can continue to influence how patients are best taken care of. I think social media is important for that.
All right, thank you so much. The next question is, are you subspecialized in and mainly focus on certain things in orthopedic surgery, or do you still do what you learn in residency?
So the answer, I'm going to answer the second question first. Whatever anyone learns in residency will become irrelevant rather quickly. So there are very few surgeries that I learned in residency that I still do the same way, because things change very, very quickly. So the most important thing about our education in whether it's being a physician or a therapist or a nurse is learning how to learn and learning how to just keep up to date and swerve with all of that. And then I'll answer the first question, which is, I am very subspecialized. I am a pediatric orthopedist who mostly does sports. So my daily life is very focused on kids who have torn their ACL or their shoulders come out of joint. And those are the surgeries that I do a lot of. But I still take regular calls. So if a 95-year-old breaks his hip, I fix it. And that's one of the surgeries that hasn't changed much since residency. I just did one of those yesterday, and there's still a very, what we call bread and butter aspect to what I do.
Oh, that's amazing. Is there a specific reason why you decided to specialize in pediatric orthopedic?
Yeah. So when I was in residency, what I found was when I did my pediatric rotation, two things. Number one, I liked going to clinic. I liked going to work. I like kids. They're funny. They get better well. The challenge was parents. And now that I'm a parent, I understand it. And parents can be very overwhelming. But I like kids, and it just made me feel happy to work with them. And then the second piece is something that's nuanced that I didn't recognize at the time, but I know now is important to me, that even though orthopedic surgery is incredibly male dominated, pediatrics has more women than any of the other orthopedic specialties. So I think that I recognized very early that if I did peds, there would be other women around. And that has played out.
Nice. Thank you so much. The next question, what does your daily life look like in the midst of COVID-19?
Yeah. So I'm going to share my daily life when COVID first started, and then I'll share my daily life now. So, when COVID first started, one of the hats that I wear for Kaiser Permanente, which is where I work in California, is I'm on our leadership team that runs the operations for surgery in Southern California. And so, for the first 2 weeks when the pandemic hit, I actually stopped clinical work and completely did administrative stuff to try and get our group ready. And those days were working from home and kind of like the rest of the population that's not in healthcare. Um, I quickly understood and remember those days. Those were the hardest days of COVID for me, definitely because we were coming to understand what COVID is and all that that means. But being at home with everybody here was an extra special challenge. And so after those 2 weeks, I went back to clinical work. So I still spend 1 day a week doing that, but my regular day when I'm being a surgeon is I am up at about 5:30. I work out before work. I get to work by about 7. I see patients or do surgery. In my job, I'm done by about 4, which is really special and awesome. It's not always like that, guys. And then and during those hours, I'm either seeing patients in clinic. COVID has been wonderful in telehealth. So I see a lot of patients remotely, which I really enjoy. And then after that is done, I most of the time come home, and because of COVID my family is actually here and not in a million different directions, and I try and unplug for at least 2 to 3 hours and around them for whatever sort of ridiculousness and chaos and bickering is happening. And then after dinner I'm often back online finishing up whatever it is from the day, and get to bed early because I'm getting up early the next morning.
Nice. I really love how you're able to integrate the life work balance and exercise and have time with your family. It's really awesome
It's doable. It really is,
to
guys.
hear that. Yeah. What is an unexpected part of being an orthopedic surgeon that most people don't think of?
Um, I would say that medical school does is not designed with enough education about the musculoskeletal system. So what I didn't recognize was how little my primary care colleagues were and are able to address um, musculoskeletal problems. So as a surgeon, I didn't expect that I was still going to potentially be the best person to see somebody who didn't need surgery. So that's kind of a funny thing. That was hard for me to accept for the beginning of my career. Now I'm proud of my ability to be able to connect with my patients and make them feel satisfied, even when I'm not recommending surgery. But I didn't expect that when somebody would come and see me and didn't need surgery, that we would all feel let down. And now I see it for what it is, which is a blessing. Great, you don't need surgery. We can do these other things.
Yes, thank you so much. We have another question, and I just want to remind everyone, if you still have questions, please, we have a few minutes left, so make sure you ask them. This one is more personal. So, what are some good books you recommend, not just about medicine, about anything in general?
It's so funny. I was reading this morning. It's called The Testaments. I'm obsessed with The Handmaid's Tale, and I'm a library person. So it turns out, I don't know, for my childhood, we always used the library, and it turns out that there's this free, amazing thing in our country. I'm a library person, and this is The Testaments is the sequel to The Handmaid's Tale. It took a month to come off the wait list, so I'm very excited. And I would say the other book that I just finished recently that was incredible. was called Untamed. Have you guys, has that, we're not so interactive, so I can't tell, but it's Glennon, I'm blanking on her name. It's by the woman who's married to Abby Wambach. And it's just a phenomenal book. It's very empowering. Thank you. Somebody said Glennon Doyle. Thank you. Um, and just a friend of mine actually just randomly sent it to me in the mail. And she said, pay it forward, send it to somebody else. So it's kind of this like chain letter that we have going on. Really a great book. And I also read a lot of Brene Brown's stuff. I find her to be really helpful in sort of taking on the world. And then lastly, something very funny. It's called Nothing to See Here. It's a really cute, funny, hilarious book about kind of becoming an adult.
Nice. Thank you so much. Let's see. Next question. Have you ever come across a pediatric psychiatrist and or collaborated with one? And if you want, you can answer the first part.
Yeah. So they are few and far between. They are unicorns too. Really, well, before I was working with Kaiser Permanente, I was at the Children's Hospital Los Angeles. So there was a pediatric psychiatry department there. At Kaiser Permanente, we are fortunate enough to have a pediatric psychiatrist. And I will tell you actually how I met him. I met him because I'm part of a team that works with clinician communication. So I heard Dr. Fitzpatrick talking about this too, that there's a language that we can get ourselves into that doesn't help our patients if we start speaking doctor speak. So it's a group, we do these really fun interactive sessions using actors because I'm in Los Angeles, and we do a lot of role playing, and it's really fun work. So I met this pediatric psychiatrist because he attended one of those sessions, and I really thought he was such a great communicator and became friendly with him. And then a few months later, there was a patient that was admitted to the hospital who had an issue. Sometimes young people can find ways to move their body in which they can on purpose get their shoulder to dislocate. And it can be a very tricky, a dislocate means come out of socket. So most of the time when shoulders come out of socket, nobody wants it to happen. And we do surgical things for them. But sometimes people can kind of figure it out for their own reasons. So this young woman was admitted to the hospital because she was in so much pain from her shoulder issues. And I became very close with him because her issue was not that she needed surgery from me. Her issue was that she needed help from him. And the pediatricians weren't able to understand that for a little while. But because he was such a good collaborator with me, and I had recognized, because I had seen that so many times in my career, the two of us together were able to sit with first the pediatrics team and then the family to get everybody on board. And he has a wonderful way with people, and it's a special job to have.
All right, thank you so much. Now the second part of the question, in your field, does the patient ever see the psychiatrist before and or after their treatment?
Yes, and I will say that with a capital Y. I think it's really important that we remember that we're treating a whole person. And even if sometimes there are pain issues that don't go along with any surgical issues, and sometimes there are pain issues that go along with surgical issues. But if we don't take care of the brain and the whole emotional aspect of the patient, anything that I do as a surgeon is bound to fail. So that's one of the reasons that I love Kaiser Permanente, is that I can make sure that any patient that's seeing me, I can have access to mental health care for them as well. Whereas when I was at Children's Hospital, sometimes patients would get the ability to see me, but not the ability to get what they really needed in that space. So really important integration. There are many clinics that are called multidisciplinary, which means that a patient goes one place and sees lots of different people. And there are a lot of sports clinics that have both psychiatrists or psychologists, as well as surgeons, as well as physical therapists, so that the patient's getting everything that they need to get better.
Yeah,
Great.
I really like that like holistic approach to what a person really is, all these different areas of their life, not just like surgery or treatment, but also their health, mental health, and other components.
Yeah.
And we have time for maybe one or two more questions. So let's see. Have you seen much improvement on how people treat female orthopedic surgeons over the span of your career?
Yes. The short answer is yes. The long answer is not as much as I would like to see. And the third part to that is also the way that I receive it. I feel so confident now. I'm no longer in the mode of feeling like I have to prove myself. And so the way that I receive the information is different. But one of the reasons I think that I love to mentor young women in orthopedics, or not so young women, is I like to see what is happening with them. I don't like to say to them because that doesn't sound empowering, but with them and around them that they're interacting with. And we actually did a study in orthopedics looking at the very question that you're asking and the way people define what they're receiving. And the answer is it's getting a little bit better, but needs to get a lot better. You guys are the future. We have to do this together.
Yes, we have to. Oh, so I see more questions now. So maybe let's do maybe two more. Um, let's see. During your undergraduate career, were there many things you wanted to do and explore, like traveling? If so, how do you focus on exploring these interests while also pursuing your career of becoming a physician?
Yeah, so important. I spent some time when I was an undergrad. I got to go spend some time studying in Germany. And I found that prepared me a lot for orthopedics, because what we do in the United States is just such a small portion of what's happening in the world. And so in medicine, it's really important that the communication is, in many ways, the United States is in a really privileged position to teach others throughout the world. And so I've gotten to do a lot of traveling to teach. And then also traveling to learn and traveling to understand that it's not there's more than one way to skin a cat, if you will. So I've been able to parlay travel into my career in that way. I also have done some work in underdeveloped countries to give care, not as much as I want to, and maybe as my kids get older, I'll get back to doing that more. But I think that there are opportunities to meld travel in all of those ways. And also there's time off. And so no matter what career you choose, you will have a little bit of time off. I was scheduled, if COVID hadn't hit, to go to Israel for 2 weeks with my oldest daughter this summer. So, we can all remember that you're not going to be doing whatever it is you choose to do 24/7.
Great. Thank you so much for your response. And I love this point because many of our previous speakers have brought up how when medical schools look at your admission, they want to see a person, not just someone checking off boxes. So make sure you're exploring what you're passionate about and pursuing who you really are, because that's what schools truly are going to see, and you don't have to be anyone else but yourself, basically. So thank you so much. Would you like to do one more question?
Sure.
If you want, would you like to pick the next one or should I pick it?
Let me go. I'm going into Q&A.
We have three left.
Okay.
So whichever one you would like.
Oh, okay. I'm going to go with what is it like working in health administration? I am in health administration because I feel that if I'm going to be grouchy and difficult about the way it's done, I need to volunteer to be up and in it. And so my role in that team is of being the voice of the physician and clinician. And I'm not shy about it. So that's why I love doing it. It can be very frustrating to the very definition of kind of moral injury or burnout is to have this sense of what you want to give to your patients, but know that you can't give it to them because the resource isn't there. And so, at least by having an administrative role, I can understand the why if I can't do it, and I can also, when I see a patient in front of me that doesn't have what they need, I can bring it right back up the chain to the top. That's the reason I think we should be involved. I also think that to improve diversity in orthopedics, we have to have women as leaders throughout healthcare so that you can't be what you can't see.
All right, I think we are about to finish now. So thank you so much, Dr. Weiss, for joining us today and for sharing your story and also how you're out there empowering women. So if anyone wants to keep following Dr. Weiss's social media, go ahead and do it. And thank you so much for being here today.
Thank you. Thank you very much.
Thank you. And before we transition into our lunch break, I just want to say how excited I am about our next presentation. We're going to hear from a very resilient and empowering speaker who I personally really admire. And she will share her story in a few minutes after break. So, in about 5 minutes, please join us to hear about Dr. Iris Gibbs' story. And her presentation is titled The Challenges and Opportunities of Being First. So hang tight and come back in 5 minutes. We'll see you soon.